So I think if
Testing, testing. Hello, hello. Oh yeah. Okay, the green lights are on. Wonder if I follow you and just stop right here if it'll.
yeah.
Hello. Hello.
It's like
Is that the one? Is that where they're like just yeah.
I think so. She's on message in the wow. Yeah, like when she like sent out. Yeah.
I have an Android that explains it.
There we go.
Yeah, I got it.
Kurt, will you smile? I want to see your teeth. So the teeth are a little bit out of focus, so focus on those just a little bit. Smile again. That's pretty good. There we go. So if you want to miss one, this is your focus and this is your zoom. I think the zoom is probably pretty good where it's at.
It's guest 1, 2, 3. I think it's a capital G.
Okay, so if these are 10 minimal prep veneers, I'm just going to start on like the distal of 4 right here. And I'm going to get, there's always kind of like a leverage point you can get right there and just start popping those off all the way around. So sometimes I get underneath 4 and like 4 through 6 come off. And then I get underneath 7 and then 2 or 3 more come off. Does that make sense? That's typically how it goes. You can almost see right now, right there where I can get it like a little purchase. But what I want you guys to see is those are his gums today. Karen, will you focus that like a tiny bit? Those gums look healthy, right? Like this is what you guys want gums come back looking like. Obviously under 9, approximately there's going to be a different looking gum tissue, but if you look at all my veneer margins, like they either stop short of the gums, or if they go to the gum, they're just like super smooth. That's what you're looking for. That honestly is the real key to them coming back with really nice pink healthy tissue. That's great, right? Like you guys feel super good about those gums that come back to you. Okay, awesome. So I know 4 is a crown, so we're gonna right here focus. It's like far near.
Those I feel like we have those.
You know what? I don't know where that came from. It just showed up. Like it showed up in a box and didn't like say where it came from, and I couldn't remember anybody who had messaged me saying I'm sending you a pillow, and it came like with Smile Trends logo on it. I have no idea where that pillow came from.
Must be nice.
It's not terrible. Let's see. Maybe we need to zoom in a little bit, or zoom out a little bit, maybe. That's not working again. See, the zoom's not working again.
It just did.
Did it?
Before you got to
I don't know. You want to take those batteries out, put them back in? Okay, so I'm going to put a few little cuts around number 4. This is where I like to have that model. Where's that model at, actually? So I want to look at that. How much space do I actually have between those 2 teeth? Not a ton, you know what I mean? Like I'm not super comfortable just slicing through there. So I'm going to be just a little bit cautious probably. So I'm trying to be very aware of where the tooth underneath there is actually at. I have like almost no air pressure. This burr is like barely spinning.
Can you turn it up?
Huh?
Can you turn it up? What's up, bro? Can you put it in there?
I guess so.
So typically I wouldn't spend as much time trying to get that crown off, but I kind of like to get it off so I can show you guys how I remove veneers. That makes sense? So I'm going to spend a little bit more time like actually trying to get this crown off. Let's see, let's cut that along there. Let's go a little bit good. Cameron, did you get that remote working? No? That's weird. So it worked after we put the new batteries in, now it's like not working again? Okay, so that's off now. So now for removing veneers, I like to just get, it's almost always like kind of the distal gingival corner. Oops, see that go flying? Sorry about that. That didn't go in your drink, did it?
Good eye.
So I kind of just, sometimes they come off really nice and sometimes they don't. Sometimes I have to cut them a little bit. So.
It's like the most satisfying.
Kind of is, huh? So that's a win, right?
Yeah.
So that all coming off so nicely around this tooth and that tooth now breaking off, that's a huge win. So now I only have veneers all the way, the rest of the way across.
Do you even bond anything around for the crown? Like you put cement in there even?
I did the opposite of bonding.
Glycerin? You just put glycerin.
So I put glycerin all over this tooth before I cemented my.
Yeah.
You didn't put any like temp cement or anything on it, or you put some into the
Shrink wrap. Yep.
even with all the crowns and everything.
Yes.
And, like section it and do it.
No, I shrink wrap the whole thing. I just put, everything else had a little bit of spot etch and bond on it,
Yeah.
except that tooth. That tooth had glycerin on it. That's hydrogen peroxide. So I did that for my patient more than me. Because when they first come off, if they've been wearing them for 3 weeks, nobody's teeth smell good under temps after 3 weeks. So for them, I just like, as soon as you douse them a little bit, that smell just goes away. So I often send temporary veneers flying all over the room. But they come off, so I mean, I don't know how long that was, but even with 2 crowns, we have all 10 off. Okay, so if you follow Michael's little recipe for putting them on, and you follow that, what I did for taking them off just now, it shouldn't take super long. Let me actually just go, let me go make sure there's no big pieces from the lingual really quick, and then we'll floss all these.
Can I turn the camera off and back on?
What were they asking for?
The focus.
To focus? So usually there's a few pieces you can get from the lingual with your scaler, and it's definitely easier to get them with the scaler than to go fight them with floss. So whatever you can get, I would get in there and get it. Okay, so good news. Nothing is bleeding at all yet. We're just like, things are just looking good. Did we get that remote figured out?
She went to go get more batteries.
Doing okay?
Mm-hmm. So if something's gonna bleed, I want it to bleed right now. You know what I mean? So I'm gonna get in there and floss. I definitely don't want to try on my veneers without feeling pretty comfortable that like all of that stuff is gone, because I don't want to break a veneer. Is Kiok in here? No? It's okay if he's not. I was going to ask him what material these are. I don't even know if they are. I'm sure they are Lissy or Emacs, but I don't know which one they are.
They can't, they're in trouble. Yeah, do you know how to do it?
Our remote's not working.
The remote's not.
Yeah. You want to rinse or you want to suction?
Better for,
I'm not going to run out of water, am I? I'm not going to run out of water, am I?
No, you're
I mean, it worked this morning. Or like when I first got here.
There we go. We're in. Oh,
No, he
that was
didn't.
his-
That was him moving. They're actually kind of like, let me tip you. Let's go right there. Yeah.
It's so out of focus.
Yeah. Can you turn it off and on?
it might mess with
Won't even turn off. Did you swap batteries again?
Yeah, I saw.
Is that a third set of batteries?
Yeah.
Dang, that's frustrating. So I'm just going to touch the middle of these teeth where I know we spot it. Without water, actually. I'm just gently touching those teeth where I know I spot it. Without water, because you want to see the like frostiness. You know what I mean?
Little tender on those.
Which ones?
Like
4 and 5?
right side.
Okay.
I think she's hitting the remote on the remote.
Are you using Lido because it's gonna last you longer?
Yeah.
or- Yeah.
Yep. So I start with Sitness because that goes in nice and easy. It's like painless. And then we do all the rest in Lido.
Okay,
Sitness itself actually wears off super fast. Very, very fast. So at this point, if you guys wanted in your office, you could air braid all these, okay? There's pros and cons to that, like I talked about. It's really great for getting those teeth super clean. But if you're gonna go back in temps for some reason, you've etched those teeth. What do you guys want to do today? This is choose your adventure. You guys want to air braid?
No.
Cole saying yes. You're saying no. Somebody break the tie.
Yes.
No air braid?
Yes.
Oh boy, we got a lot of yeses, a lot of no's.
Yeah.
Let's air braid just for fun, so you guys can see it. Can you kick that over here?
I have a question. Why did you use the diamond for, like, were you trying to remove the excess temp cement?
So I know that I had etch and bond and dead center in the middle of all these teeth. So I kind of assume that there's a little bit of excess right there. You know what I mean? So
With
I
the
just like to
abrasion,
touch it.
Is that not gonna get
Maybe.
those off?
Maybe, not always, depends on how hard it's stuck on there. So if I'm gonna do this, I'm gonna do it really quickly, because I'm not really looking to like etch those teeth. I'm just looking for something that looks like temporary material. Those all look really good. So I'm kind of doing this quickly. I'm not over etching these. Is it working? There we go.
I switched it to. Well, I double checked it. Yeah, I know.
Does anybody else have a comment?
Yeah.
Like some of them are.
I think you might.
Okay, let's try these babies on. Let's do glycerin so they kind of stay in there. So I actually keep my liquids. I keep my liquid strip tube, and I just because I like the way that it delivers, and then I just keep refilling that. So we just keep refilling that with special sauce. Have you guys heard the story why I call it special sauce yet? No? So it was actually the day we were seating Tejas Patel's veneers in here, and there were thousands of people watching us do that. Uh-oh, who's got the remote? Are you doing it on purpose? Oh, okay. So I was nervous. There were so many people watching this go down. You know what I mean? And I wanted Karen to hand me this. Or were you here?
I wasn't here.
Karen hand me this. And the only thing I could think of was KY jelly. I couldn't think of any other word for that. I couldn't think of liquid strip, couldn't think of glycerin. I could only think of KY jelly. I didn't want to say that. And so I was like, hey, will you hand me the, the special sauce? So ever since it's been special sauce. All right, let's try these babies on. What? That's, yeah, yep, it's KY jelly. Kurt, let me move this up just a little bit. Is that okay? Try that. That's gonna be a little bit better view for you guys, I think. Go put his maxillary teeth right in the middle of the screen. Does that make sense? Who's driving? We are going backwards. All right, so my biggest concern is 8 and 9. So we're just gonna try those two on. We're gonna see what we think with glycerin. We're gonna see what we think with try and paste. Let's just see how this goes. Nobody actually knows. And then put his maxillary teeth in the middle of the screen. There you go. There you go, perfect. Okay, so we're just gonna try these two on all by themselves.
Why are you using glycerin instead of the water trying that you usually do?
Because that's a little tiny nub and I don't want it to fall down his mouth. These are the paintbrushes that we use. We get these from Amazon by the hundreds. We don't sterilize them or anything. We just one-time use, throw them away. Gosh, that kind of slippery. Holy heck.
Wow.
Those are freaking close. Those are very close. In real life, I don't know what they look like up there on that screen, but in real life, those are very close. So everybody come look and see how not close in color these are. Yeah, put your glove, hold your hand out flat. I want you to see how not close in color those are.
Oh, yeah.
Those are so wildly different in real life. I mean, those are like 3 shades off. You know what I mean? Isn't that wild?
Can I
And
get a
then
picture of that, James?
you should get a picture of this.
Sorry, I just- I don't know what that will show up like, but now it seems like. Yeah, see, they're not even close.
Take that again with these a little bit closer, Michael.
They're really-
Wow.
They are so freaking
How do they
different.
look, Tim?
Good, you want to see them?
Yeah, can I take a picture of that now?
Yeah. I put more glycerin on and let's get them cleaned up real good.
Yeah.
You wrapped 8 a little bit under the lingual, right? Or is it about 90?
I mean, it should be about. I'm not,
Pretty sluttish.
Where's Keita?
Are you just using the rest of the?
what's that?
Yeah. Just a quick
Yes, exactly.
clean that up so we can get a photo of it.
We're gonna drop the camera on.
Those pictures are
Why would
insane.
you say that? What good does that do? Oh,
Will you-
you said that.
Will you,
just like hold it like it doesn't weigh anything, and I would hold it like.
Can you throw those in a slideshow so we can just do like a debrief on this?
Yeah,
Okay, let's keep trying these in. Let's get the rest of them in.
I'll do it. I'll take a full try photo.
Oh yeah, there you go. I'll bring you back when I get them all in. Where'd my paintbrush go? I set that down. What do you guys think? You guys feeling pretty good about it so far?
That was so easy.
So easy.
How thin are these veneers?
We can measure one if you want here in just a minute.
Okay. I
Probably,
wasn't sure if you did, some of them were no preppers.
these are almost all minimal prep. Now that I got temps off, I can pass this model around for you guys, and you guys can see what those preps actually look like. So a lot of dentists get like, especially new dentists, they get like obsessed with what is that? Because this is what you teach in dental school, like the shape of that prep is everything or whatever, you know what I mean? And it's easy as a new dentist to get a little bit obsessed with what should that prep look like. What's important is that you have enough clearance and you have draw. So just think, I've got room and I've got draw. Like I know these can be at least 7/10 of a millimeter thick, and there's a way for this to go on and come
Good
back up.
job, Kiak. That was
Kiak, do you want to come look?
Yeah, come look at it. Come look. You saw my picture, but
Thank you, guys. Thank you.
He makes us look good. We're not even good. But look at the
running.
difference there. Is that crazy? And this is nothing that James did special other than
Nope.
take really good prep shape photos.
That's literally the only thing I did correctly, was take great photos from my lab to work off of. Will you put something on for him? Michael, do you want to come grab a try-in picture?
Can we get him retracted?
Yeah, we can get him retracted.
Well, I can't believe it's being ugly anymore. That's for sure.
You'll find something.
I'll find something, yeah, right? Dude, are you kidding me? Are you kidding me? I know, that's fine. He doesn't need
I should have worn my Travis Scott today too.
You have Travis Scott? Yeah.
Dude,
I'm such a big fan.
Don't you have a shoe on here?
Yeah, have you seen it?
No.
I'll come check it out real quick. So the clock.
Oh,
So the 1 o'clock is the Jordan 1,
Uh-huh.
2 o'clock Jordan 2, 3, 4, all the way to 12.
That's pretty sweet.
Kind of sick, right?
Did you buy them specifically for this purpose, or did you already have them? Put them
I
on?
had these
I
two.
heard shoe wall and I have.
Those are the only two shoes.
Drop.
You can see these have been worn by me. Those are
Yeah.
the only two that I had worn.
Okay.
So every other shoe I bought for this clock.
Okay,
It's like a $5,000
Yeah.
clock.
that's cool.
And it's like a working clock.
Yeah,
That's
I think it
why.
needs a new battery, but it
Yeah.
doesn't feel like a working clock.
Nice.
Fun, huh?
That
Yeah.
is sick.
I remember the story of why you have this, right?
You've heard about my blown up?
Well, yeah. Well, I heard the office blew up.
Blew up.
Yeah. What was it? You were next to like a Safeway or a Fry's or something? Blew up? Is that right?
I was by like a print shop, like
Oh, okay.
4 units down that blew up.
Are you new to like this location and this office?
4 years.
4 years.
Yeah.
Okay. Okay.
So I was homeless. My office blew up. I was like, as an office, we were like homeless. We were like portable, working in like, oh, your office is open those 2 days. We'll come
Yeah.
use it.
Yeah.
for 10 months while we built this out.
Wow.
Yeah.
No, this is a beautiful office. So
Yeah, thank you.
yeah, it's really nice.
Crazy. What a crazy story too that your
Yeah,
office
it's
blows
such
up.
a wild road.
Yeah. You were kind of cooking in that the other one though too, right? Like you were like.
We were. It was honestly like day one, like the day it blew up. It felt like the most devastating thing ever.
Yeah.
Because we had tons of momentum. We had huge influencers come in to see us, and I was honestly just getting to the point where like I didn't have to do any general dentistry. Like I was booked out for a couple months with cosmetic dentistry. Didn't have to do any general dentistry, and boom.
Yeah,
Crazy.
that is wild.
Not something you had in your card, I'm sure.
No, that was not on my bingo card for
Yeah.
sure.
No, that is awesome.
Did you guys get to see how different those veneers look
Yeah, we did.
in person, and then they go on the teeth and they match super, super well? Unbelievable. That's the power of your prep shades, your prep shade photos. If I didn't send those to my lab, the whole day is a disaster for us. You know what I mean? Yeah. Yeah. How many pictures?
That's ridiculous.
I probably had 4 or 5 tabs in the picture, and I probably took 10 different pictures at different f-stops. So they had like, there was a chance of me giving them one that was like overexposed, underexposed. 10 pictures, 4 or 5 stump shades. Give them all the information. You know what I mean?
Yeah.
What's that?
This is that one.
I think we're 3. I think we're on 3.
Are you worried about the darks?
Put them in, Kurt.
And I have a little piece where you get that little divot. Yeah, like that kind of color a little. I don't know. Which it never does. It's always funny. But can you look them now?
So do you know what I told Courtney she should do today just to get a shock out of you guys? I said, at some point when I'm like mid-sentence, just shush me like, actually, da, 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 da.
I'm like, the doctor's just like, who is this girl?
Who is this girl?
So funny.
Okay, what's next? What do you guys want to do right now?
Kurt wants to see his two basketball.
Oh, he hasn't seen them? Everybody's seen them except Kurt? Yeah, we should definitely let Kurt see them.
You want to grab that?
Okay, so docs, the temporary reveal is the reveal that goes on your Instagram with like the tears, the hugs, all the stuff. Do that, mirror on the wall that's lighted, standing up, seeing their full face.
So good, huh?
letting them see. Do you like the color?
The texture and like the consistency looks so nice, especially the before.
The permanent veneers, like if you let the patient stand up, sit up, walk to the bathroom, like
You like it?
risky.
Color looks so good.
So for me, the patient stand
Create
just like
these
this.
too much. So good.
If anybody finds like an awesome mirror with an actual good light, we've tried a couple different ones that have like the LED lights
like
on
them?
them. Yeah, dude. I don't love any of the ones I found. So if you guys find an awesome one, let me know. Okay, what are you guys thinking? What should I do right now?
Clean the veneers.
Clean them? Okay. What I want you guys to really get in the habit of doing is I'm going to look down at him. Let me put my loops on, even though I'm not going to look through them because I'm going to dirty my hands. I'm going to look down at them and I'm taking a snapshot of what those look like. Because right now I can look in my mirror. Can you guys see my mirror?
Yeah.
Look at those margins. There are no black gaps. Those things fit airtight. That's how your veneers from Bob and V-Smile should look. Airtight, right? So I can see that right now. Once I fill these with cement, I can't see that anymore. So I'm just gonna look down at these and I'm kind of like studying the profile of my premolars, because if something goes on funky, it's for me, it's often a premolar. I'm looking at, you know, the inclination of my front 4 teeth. Do I like that? What do those embrasures look like that? What do you guys think of these embrasures, by the way? Those embrasures look good, right? Those look so good. Kurt, will you turn a little bit to your left? And then put your chin down, like, or maybe even lift the back of your head up a little bit. Turn a little bit more to your left. A little more. And then tip your chin down a little more. See, those embrasures are just nice. They're actually better in real life than they look in that video. Okay, you can go back to comfy, Kurt.
You want to talk about color shades with like the tempering cement?
About trying?
Trying.
Okay, so because these are, let's measure one. Is there
Yeah, on that top one. Should be a new one.
Yeah, there we go. So the reason I like this to measure veneer thickness with is because the spring in this is pushing it away from the veneer. So the only pressure on the veneer is the pressure I'm creating here. It's never going to clamp down the veneer. It's only the pressure that I put on. Does that make sense? The spring is pushing it away from the veneer. So let's take off like number 10. Let's see what our thickness is. I am almost 100% sure I just stole this from V-Smile.
I know, I saw 4 millimeters.
So I'm 6/10. I'm 6/10 of a millimeter there. So not super thick. So a little on the thin side, probably. Like I like to live 0.7, 0.8, 0.9 in that range, better than I like 0.5 and 0.6. So that was a little thin. So let's just talk about like color. So this is a glycerin Tri-In or a water Tri-In. Those both gonna look the same. I love the look of these. Kurt likes the look of these. They're probably very close to OM3. I think that if I do a clear cement, these are thick enough that they're gonna look really, really close to this. If we wanted to brighten them up a tiny bit, we could do that soft white from Panavia. That would brighten them up. Kurt, you being a dentist, this is not a conversation I have in front of my patients. This is a conversation that Courtney and I have before and after deployments. But you're a dentist. What are your thoughts? Or do you want to kind of keep these right where they're at? Or do you want to?
I just want them to look natural. Like, I don't want anybody to think, oh, he's got veneers.
Okay. You're pretty dang close to that right now. You guys want to try in some Tri-In paste just for fun?
Yes.
Let's put some clear under 8, and then let's put some soft light under 8, and let's see if that changes the way we feel about anything. Oh, you know what? I was gonna show you guys actual colors of these try and paste and the actual color of the veneers.
Do you want me to start doing clear right here and then lining them up?
No, I want them to see it actually go on. So I feel like that didn't change a whole lot. That stayed pretty much the same. So if we use clear cement, let's see how thick this veneer is.
What kind of material is that from?
That's what I was going to ask Kia. It's either Emax or Lissy. I actually don't know. Did he say Emax? Okay. So we're like 0.7 there. So I'm not worried about the cement really having a big impact on these. If these were like 0.5 or 0.4, I'd be a little more worried about it. Let's see what soft white looks like. Kurt's like, put those damn veneers on my teeth already. Why are we playing games? So I personally don't feel like that made a huge impact on that. Whatever change that was, I think was pretty insignificant. That was soft, right? Soft light. So I don't think between clear and soft light, because the thickness of these veneers is going to make a big difference. So let's do soft light. For our permanent cement, let's do soft light. But just for fun, you guys want to see what light looks like the Light Plus with
You want light plus?
Ivoclar?
So is this warmer? Or
The Light Plus from VeriLink
yeah.
is it's not the freaky bright from Panavia, but it's can you see it?
Oh, yeah.
It's definitely brighter than the soft light.
Okay.
So even that with these veneers, I don't feel like made a huge difference.
No.
So let's go soft light just for fun for our permanent one. But let's do a little experiment here on my glove for you guys. So Courtney, hand me like the clear try-in and the clear permanent. So this is Panavia's clear try-in paste. We're gonna put that right here. Here's the clear actual. So close, not exact. Can you guys see it?
One's the permanent, one's the paste.
Try and paste, permanent. Okay, what's this? Soft light, Panavia. Try in. Definitely a significant difference between those two. And let's see how close that actually gets us to the permanent. Close-ish. That's pretty close, I think. Probably closer than the clears are, I think. And then let's do VeriLink Light and then VeriLink Light Plus. I want to make this as hard as possible on Courtney.
You want the
So this is that's VeriLink Light, try-in, VeriLink Light, actual cement. That one to me is not crazy close.
Yeah.
The Panavias are closer to me than that one. Light Plus try and paste. Light Plus actual veneer cement. Once again, not super close in all reality to me, to my eyes. Oh, sorry guys. Sorry, waiting room people. So I'll show you what everything is. So this row is our try-in pastes. This row is our actual cements. So we have these two, this and this are Panavia Clear. This is Panavia Soft Light. This is Ivoclar's Light, and this is Ivoclar's Light Plus. Ivoclar's probably represent the actual cement not quite as well as Panavia's. I think Panavia's are a little bit closer. But the actual cements, here's the other thing I want to see. The actual color of Panavia's Soft Light and Panavia's or Ivoclar's Light are very close. Those are so close. But because I like the consistency of Panavia, I'm going to use that one anytime I want that much brighter. Do you have some of the white, the Panavia's white? The actual cement? No, Panavia is like white. You know what I'm talking about? So Panavia does have, if you want to warm something up, Panavia does have a few different ones. Oh, that's the try-and paste though. Let me see that though.
The white cement too.
Oh, the white cement. That's what I want. This is the cement I would recommend not ever using. This is so abrupt. It's so intense.
Oh, jeez, you're so trying.
That's white. So this is the one I recommend not ever using, is that Panavia white. It is like the Panavia white. Don't ever use that. Don't even have it in your office.
Even the trying paste.
The try and paste is just intensely white. Okay. All right. Let's quit goofing around. Get some real work done. Okay, so we're gonna go soft white. We're gonna go soft white. Sometimes I feel like doing soft white as opposed to clear. Sometimes I feel like it gives me just a little bit more consistency across everything, and so we're gonna do that. So this is kind of important too. These veneer me's, they don't come with numbers on them. We put those on there so that we always know where we're at. Do any of you guys have one of these veneer me's in your office? Yeah? They're money. I actually can't imagine doing veneers without them now, honestly. They're like that important to me. Courtney, how would you clean these veneers if you didn't have that?
Very sketchy.
Over the garbage can or something?
Yeah. Would be a mess.
Something super sketchy.
Probably like one at a time over a trash can.
Yeah, one at a time over the trash can is the alternative to the veneer me.
We put a little, we have a small hole over there, so I put a bit over it. So I could get it.
Yeah, you need a $35 Amazon veneer me. Okay, what are we doing? What's the plan right now?
You're gonna clean tissue condition.
Tissue condition, how are we gonna start?
Biscuits.
Put Viscostack Clear on there 5 minutes and just leave it. And what's Courtney gonna do? What's her steps? Somebody remind Courtney what her steps are. How? What does Courtney need to do?
I vote clean.
Siling them 10 minutes before, right? Get your Viscostack.
And they came etched, right?
They came etched, which if you're only doing a veneer case once a month, it's great to just ask your lab. These are etched, correct? You send them a text. Send Bob a text, send V-Smile a text. These are etched, right? Or if you're using some other lab. Yeah, go ahead. So Courtney's she's gonna rinse them first just to get like the gross amounts of saliva out, right? And then she dries them, and then she's gonna, can you guys see that net that's over that? That's the key to this whole thing, is that net. You guys can come, I'll get out of your way. You guys can kind of just come watch Courtney, and I'll actually have Courtney rinse these off. Because a lot of times in real life, I'm like leaving to go do emails or go talk to my social media girl, whatever I gotta do, go talk to my front desk, and I got some videos to record. I record tons of videos for what it's worth. Like that's how we communicate with patients. Like it's almost all videos, whether it's virtual consults or Loom videos or, recording them, videos of their smile design, all that kind of stuff. So my patients are out of state, tons and tons of videos. So that's usually what I'm going to do while Courtney does this. And she kind of looks at the clock and, depending on how these are doing, 3 to 5 minutes from now, she's going to rinse that off. If she's worried about something, she'll put some back on. And sometimes I come back and Courtney's already like scrubbed them with hydrogen peroxide. Okay. So, if you train your assistants, they can be like rock stars for you. Courtney, for the record, not looking for new employment. Not looking. Okay, cool. All right. I'll let you guys, I'm going to move so you guys can kind of come in here and watch Courtney. I'll even move my chair out of the way a little bit, and then we can put it back when we're done. You guys can get in there and watch if you want.
You're gonna pay a little bit more, but it's a lot better.
If I remember to do it, or if my assistant hands it to me, I'll do it also. Dude, that is a freaking
Okay, how we feeling? Will you guys push that chair back over here? Okay, slim those up a little bit. Alexa, play music. You guys feeling good about the tissue? Feeling really good about it, right? I'm feeling great about it, but I still just don't underestimate the power of etch. Etch will find some little blood vessel and make it bleed. Yeah, let's on the left side up a little bit. He was feeling a little bit right here by 7 and 8.
Yeah, 6, 7, 8.
6, 7, 8. Okay. No, we're good. Okay, how do you guys plan on managing the 2 crowns? Anybody have any thoughts on that? Are we doing light cure? Are we confident we can get light through there? We're gonna do dual cure? Dual cure?
Yeah.
We put them in the same time, put them before, put them after. There's not a wrong answer. I'm just curious how you guys do it.
I think that's all like
You can stay organized and make sure you have.
Okay. Okay. So you can do it 2 different ways. I wouldn't do the crowns first, but I would consider doing the veneers first, but having the crowns in place with no cement on them, so that everything is holding itself. I would consider that, or I would consider just trusting my assistant's going to put the right cement in and just load them all up, and then I'm putting a little bit more pressure on those 2 crowns as they kind of set. The set times like 2 or 3 minutes or something. So just being a little bit careful with that. I think that's probably what I'll do. Should we do that today? It's a choose your adventure day. Okay, let's do one more scrub, Miss Courtney. I'll do one side if you want to do one other side. What's that? Can't get your glove on. This is literally one of the most important things you guys can do in this appointment is remembering. This is why the checklist is so freaking important. Do you know what I mean? Put this on your checklist. Take a cotton pellet, doused in hydrogen peroxide,
3 times.
and clean off. Yeah, I mean, I would rather do it 3 times than forget it. You know what I mean? There's no harm in overdoing this.
Do you use like chlorhexidine or just hydrogen peroxide?
Hydrogen peroxide. Did I say chlorhexidine?
No, I was just.
Oh, hydrogen peroxide.
And if you were to use the superoxide, it would just crush the gums too much. If you did all of them,
You could just, here's what I'll tell you about superoxide. I actually didn't mention this before. Superoxide is very strong, and the gingiva does really well with it. It just kind of stops the bleeding, everything turns white, leaking suction. But mucosa does not do well with superoxide. You can create a pretty significant burn on their mucosa. So if you had superoxide on those gums and you just let the lip drop like that for a minute or 2, it would really burn that lip. Yep. Okay, cool. So Courtney, we're gonna do dual cure on the 2 crowns, like for everything else. We'll just go just our usual order. Let's throw this in there.
Dual cure is gonna be clear.
Yeah, we're not worried about that changing the color, whatever we're doing at all. You could do soft light though, that'd be fine. Get up there. Okay, cool. Are we still focused on the camera? Close?
Yeah.
Fairly close? Okay. Okay, good. All right, so let's go ahead and air braid these again. One of the other beauties of air braid, so this is how you want to hold it. Can you see I'm pointing that? One of the other beauties of air abrasion is that it's also helping you get rid of whatever viscostat is still on those teeth. The only downside of air abrasion is just messy. Always messy. Okay, so let's touch a couple of these with superoxyl real quick. So I'm just going to touch the tissue around number 9 there with some superoxyl, and then I'll probably touch it again after we etch. So you guys will notice when I put this on here. So I like to have this Obfuscate in place when I use the superoxyl, just because I'm so worried about like getting it on mucosa anywhere. Does that make sense?
It does burn. I got it on my leg before.
Oh, really? Can you guys see it bubbling up there?
Yeah.
I also don't like that little bit of redness we got going on around number 4 there, so let's touch that.
But it works so well.
Okay, so let's etch, and then let's see what etch causes the bleed for us today, and then we'll touch it again. So I like to have, you guys can do this however you want. I like to have my assistant etch with me. So she'll start on one side, and we're gonna do the crowns last, because we know for sure we've got some dent in there, right? So you also want to make sure you got around the inside edges a little bit, because you want that to be bonded on there too, right? And then if your assistant is right-handed and they sit on the left of you, it's easy to miss. It's really easy when you're sitting right there to miss the distal of the canines. So I would let's double check that. The distal of the canines and the premolars actually. Okay. And then nobody wants that sprayed down in their mouth. So just suction that off as well as you can with your surgical suction. I always check in my mirror to make sure there's like no etch hanging out on the linguals anywhere. I think we're good. We'll use suction mixer one more time on the right side. So if you guys can get a chair that's set up so that you have a dedicated air, if not air and water, I think that's really, really valuable. Okay, so there's a bunch of ways to do this seat process. So Michael and I have been playing around with the split dam method. Have you guys seen that? Where you cut like a horseshoe in a rubber dam and then you use 2 clamps on the molars, you put it back there. That's awesome. That's a really cool way to do it, to keep like all the moisture and the breath off of your tooth preps. I love that. I think at the very least, put something there just to catch the moisture in their breath. So I'm just gonna let that hang out right there. You can see how that's gonna catch most of the moisture, and I might swap that out once or twice. But so we are like ready for bond here. We've got really nicely etched teeth. Yeah, it's looking good today though. So when it comes to getting the bond on there, I'm not real dainty about it. I'm just getting it on there. Got this big green bendy brush, and we're just getting it on there. Now make sure I get a little bit on the linguals, because we know we're kind of the size of the ledge there. And then let's get some on this crown back
Do you
here.
just have composite on his bill then? Or is that like a different substructure?
That is just composite. There are different ways you could manage that if you were real worried about the bond to that. There's different ways you can manage that composite. For this scenario, everything I have going on here today, I'm okay just treating that as if it was, dentin or enamel. You could there's definitely different ways you could treat that for sure. And then I do kind of like to go back and just scrub it in. I don't want to spend a lot of time doing this, but I'll go back and just give it a little bit of a scrub now that I got everything covered in that adhesive.
What bond is this?
This is adhesive. This is Ivoclar's bond. Okay, so now we're just gonna blow air really good on that. This is the key to this. So she knows I'm gonna start on the right side. So Courtney's already over here with her suction, because I don't want to blow air or saliva that is sitting in the back of the mouth there up onto my teeth. And then she's kind of just following me all the way around. We'll blow air until things just kind of stop moving. Okay, so in theory, if I cured that bond, my bond to the veneer is going to be a little bit stronger. But for us, it's not worth the risk. It's not worth the risk because there's so many places with these 10 teeth that could hide. Okay, so Courtney gives me a brush, gives me a little 2x2 to wipe this off with. I'll try to get that in the shot there. And then she's going to start handing me these veneers one at a time. You know what? Let's put 9 on. And then I can clean up all that dual cure. So I can clean up all this stuff that's going to be set up in like 3 minutes. You know what I mean? Will you give me a new paintbrush? Because I've got dual cure on this now. I don't.
Oh, you want to take this from me?
Oh, you gave me 7. Went back on me. So I'm going to switch paintbrushes just because I do have some dual cure on there. Huh? Just leave it right here because I'll use it again for around 4. So I'm going to switch that up just so I'm not kind of cross-contaminating those cements. Do you know what I mean? Because it does have an activator in there, so I just kind of don't want to mess around with that. It's probably fine, but just to be safe, I'm gonna skip it.
Do you want me to be full last or in the room?
Give it to me last, I think. So did you guys hear what my assistant just asked me? So Courtney's thinking over here, right? She's not like a robot. So she knows I usually go 6 and then 5 and then 4. She said, do you want me to give you number 4 last? Because she's already thinking, that's the tooth that I have to do a different cement. I know that's going to set up quickly. So she's thinking over here, right? Like that's the type of assistant you guys want. You want somebody who's like actually thinking about what you guys are doing. This is a pretty critical process, and you want somebody to be like not half asleep over there. So I'm kind of keeping an eye on 9 there. That's going to be like cured and on there in just a minute. So I want to make sure it's in the position I want. So I will get rid of that cement right there with my brush, but you can see how careful I'm being, right? Like you do not want to lift a veneer at all once they're in place. So I'm being so gentle in how I'm removing that cement from the lingual dose.
Important.
So imagine if I had to adjust like 3 or 4 of these contacts for this to go in. Imagine how different of a day that is. That is a way, way, way different day. Okay, what I like to do is like take the back end of a cotton roll and just wipe off like all the excess cement on those guys. I might go in, especially around these dual cure ones, and just kind of get my brush in there, make sure that's seated nicely. And that one, I might even, do you have let me see a bendy brush. I might even go in from the lingual on that guy. And so the thing about dual cure, the reason I'm not like freaking out too much about the excess cement around the dual cure cleans up way, way, way easier than light cure. So I'm not super, super worried. Okay, so I am comparing what I see now. I like to put my glove, the reason I wear black gloves is I like to be able to put my finger behind those teeth and be able to see all the embrasures. Does that make sense? If I have a white glove on, this doesn't work. So I like to wear black gloves. I'm gonna look at the profile of all my premolars and my canines, and it looks just the way I remember it. So I'm confident that everything is actually seated the way it needs to be seated. I've cleaned the front surface off with the back side of my cotton roll. If I wanted, I could go in and dab just between the teeth just a little bit more.
You're always moving away from the contact point, like interproximal contact point. Like cement, so it doesn't get wedged up.
Not necessarily with my brush. I'm just trying to kind of get it in there, honestly. But when I'm cleaning it, yes, for sure, for sure. Okay. So I like it. I put my glove back there. I like what I'm seeing with this. So I'm gonna start tack curing these on. So I put a tiny bit of pressure with my finger, and then my thumb's kind of just holding it in place. And I'll put that curing light up against my finger now. Can you guys see that?
Yeah.
That's how I like to hold these. And then it's just like on, off. That's it. That's my tack cure. Same thing here. So on, off. Or tack cures. On, off. On, off. If we want to go tack this last one, we probably can. Just kind of hold it in place. We don't need to. It's probably already there.
That's on the tax setting.
It's not. I can put it on the tack setting. I kind of like to be in control of the timing instead of just trusting it. So it's easy for this to kind of like slip around a little bit. So I like to push with my finger, push with my thumb, and then let the tack curing light sit right against my thumb. Okay, so we're tacked in place. So now, let me see that 2x2, Courtney. So I'm just going to I'm going to get rid of this guy. I'm just going to kind of get rid of some of the gross cement back there, the gross excess. You don't want to really touch the linguals at all prior to this point, just to try to avoid getting those weird black bubbles back there. So let's hit the facials one more time, kind of quickly. I think the key to this whole thing is to not be in a hurry. Just be deliberate. Does that make sense? You're not in a hurry, you're just being deliberate. Like, know what the next step is. And for you guys, that for sure should mean having an awesome checklist next to you, so you don't forget any of the super critical steps. Like, worst case scenarios for you, you're laying in bed tonight thinking about that case and you're like, oh my gosh, we didn't clean the viscous step off with hydrogen peroxide. And then it's a time bomb. You know, it's literally a time bomb, and that patient's going to call you in 9 months and be like, hey, should these veneers all be turning black? You're like, yeah, that's normal. Give that some time. That'll go away.
Let's see you back in 6 months.
I told you that would happen at 9 months, and also I'm retiring, so don't call me again. Okay, this is about how much of a tail I want to have towards the lip, right? So your right hand or left hand, this could be a little bit different. And this is a glide floss. So it's ribbon shaped. I want to have my fingers about that far apart, okay? And we might not be able to slip down in between 8 and 9. Oh, we got lucky. We were able to get right down in between there. And then I pull that tail through. That contact is so freaking clean right now. It's not even funny. When we fully cure these, that contact is going to be so easy for Courtney to clean up. Okay, so we're just going to slip it down in between there. And you can kind of like, just don't let it snap, right? Like what you're trying to avoid is letting that floss snap down on that papilla. And you just kind of pull it through. So we're probably not going to get in around 4 for sure.
That other tool looks a little harder to manage, that metallic thing that you guys substitute for the floss.
I don't substitute anymore.
No, you don't.
Nope, I clean it up afterwards with that.
Oh, okay.
I used to use that. I would just kind of like let it glide through. This is way better though, because the tail, the whole tail is like pulling, cement out. You know what I mean? Okay.
Wow.
So Courtney is going to fully cure these now.
It looks even better now than in the try-in, if that's even possible.
looks
Yeah,
so
they're like
good.
hugging the gums now.
Yeah,
Looks
it's
so
just
good.
like that cohesive look you were saying, that'd be
So I'm going to show you guys how I clean up probably like 2 teeth. And I'll show you how easy it is. So if you follow this step by step, your deliveries can go just like this. So what I would tell you is just kind of take a big breath and just be like, I know the next step, I know the next step, and don't be in a hurry, just go step, 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 step. Does that make sense? Just follow, just like you're baking cookies, it's like a recipe, and it can go just like this. And I'm telling you, the amount of work we have to do from here on out, my first like 50 cases was so much freaking work from here on out. And I knew the patient was about to have a bad experience because I was just gonna like tear their gums up the next 30 minutes. But the amount of work that me and Courtney have to do right now is so little. There's some dual cure stuck around 4. Other than that, like it's mostly cleaned out. This is gonna be an easy cleanup. Courtney, cure those front 4 really good. And then let me just clean some of those up. So other than around 4, I probably won't use this at all today. This is my something stuck and I got to get it out tool. Maybe around 4 I need this, maybe not at all. The other teeth for sure, and I for sure don't need this. But I will use this guy. Okay, this is your proxy disc. And I'm going to bend that. I'll clean up 8 and 9. I'll bend that towards 8. And you'll see it kind of like slice off anything that's there. You can almost like hear it's like, and then we'll just go all the way around with that, and then we'll floss that stuff out. And then I'll show you how we kind of clean up the linguals, check the bite, all that stuff.
Do you want to bring me one of those so it doesn't have any dents in it?
Where is it?
That first row. Oh, you're good.
What first door? Right here behind me. Will you see if there's a brand new proxy disc in there?
See how easy it is to deliver videos?
Let me know.
So easy. So easy. All you have to do is have a throne like that.
It's all in the chair. Yeah, one of those. Yep,
Like
one of those would be
literally,
great.
Next time you go to deliver veneers, like picture James in your mind. I am Dr. Heaton.
Don't do that.
Legit how-
Don't do that, because what you guys don't know is like I've probably broken more veneers than almost any dentist you know. I've made like all the mistakes. So don't harness your James Heaton energy. Harness your Courtney energy. That's what you need to harness. Dude, Courtney's in here like.
Can I get a picture of that real quick?
Yeah, for sure.
Bite down about halfway. Oh gosh, I hate it when I do that. If I had $1 for every time I did that. You can make fun of me. Go ahead. I don't care. I can take it, Courtney. That's way too light. There we go.
I told Courtney, I was like, hey, at some point during this appointment today, I want you to like cut me off mid-sentence and shush me, and then start talking. See how the doctors react.
Actually, this is how we do it.
I mean, that is immediately after delivery. That's like, his gums look awesome. Kurt is
You're doing so good, by the way.
great.
Okay, so here's our proxy disc. And Courtney's still going to cure these a little bit more, but I want you guys to get a good idea of how I clean up, and then we can get back and continue. So I'm going to curve this
That's the problem here.
so that it can wrap around number 8. And then I just let the leading edge of that just slide down the mesial of 8. Okay? And then I can flip it, let it slide down the mesial of 9. Slide down the distal of 8.
I know that.
And it's kind of just shading off cement.
And that's a lot smoother than that other device, right? That inner proxy white.
I think it's just thin.
It's
Thinner.
thinner, and the edge isn't serrated. That's a serrated one.
That cuts, right?
Yeah. So I'm just going to do that all the way around. So I'm doing it mesial to distal on every single contact. Once I've done that, now I can floss through that contact. This is like cleaned up. Are you guys seeing this? It's just like there's almost nothing in there for me to clean, right? It's just so nice. So then I'll take my scaler, and we're just going to clean up whatever cement, whatever excess cement is around there.
It's interested. We're trying to get him to come to Arizona. He won't tell you what kind of camera to buy, but he'll show you how to use it.
So we'll go around. I'm just doing a couple teeth to kind of demonstrate for you guys. We're going to go around and clean that all the way around. See it's starting to bleed right there. So Courtney will hit that really good. Make sure we're cured good.
We're not up there, you know, not one of us.
And then I'll clean from the lingual a little bit. So I'll clean from the lingual. There's almost always a little bit of flash hanging out just right on the edges of the teeth. So I'll go and clean from the lingual. Okay. And then this is the part I want you guys to see. Courtney, you gotta get me. Oh, there it is. Can you guys see this burr right here? That's a really small football diamond and it's red. So do you guys remember I told you the lab, they don't ever want to leave you short on the lingual side. They would love for every single one to just be an exact butt, right? But they're going to err on the side of giving you a tiny bit too much. So you'll take this and you'll just lay it. Let me try to get my mirror so you can see it. Let me clean my mirror a little bit. Hang on. You're just going to lay it. Let me get that mirror so you guys can see it. There we go. You're going to lay it just like, I actually can't see in my mirror. I can see in the TV. Just like that. And you're just going to kind of burnish that margin. And you'll be able to see if there's like a little, if there's the tiniest little gap there, even a tiny, tiny gap, which you almost never get with V-Smile. Other labs, you'll get a huge gap, like literally a huge gap. When you start to do that, let me do that one. You'll see the dust kind of collect between the tooth and the veneer if there's a tiny little gap there. So that, to me, just looks so perfect. I love that now. I love how that looks. I'm going to do that on every single tooth all the way around. And I'm not going to immediately polish because I'm also going to check his bite. And when I check his bite, I might be making more adjustments I have to polish too. So I'm going to polish all at the same time. And then at the very, very end, I would recommend you guys do the cure with some liquid strip, KY jelly, also known as special sauce, around the margins, and then give it one final cure. Okay. What questions do you guys have? That's it. That's the delivery. So we're going to let Karen finish curing. Sorry, Courtney finish curing. And then we're going to, I'll come back in and make sure his bite's okay. He's on all his natural occlusion except number 4. We're going to make sure 4 is a nice occlusion. Everything else is just like tooth to tooth occlusion. So I'll look at how he is going left to right, make sure he's got really shallow canine guidance. We already talked about what we want in protrusive. So we'll look for all that stuff.
And you said your margin is a little supra, or is it right at the gingiva? Your veneer margin.
Because you didn't use any retraction days during forward.
They're all right at the margin, right at the gingiva. Yep. Yep. And because I did a little bit of gum contouring everywhere, like that's a really nice gingival margin. It's not like a thin knife edge margin that I'm worried about disappearing. You know what I mean? It's like a good margin because it's one that I deliberately set with my laser. And so it's like a kind of a thick, nice margin. Not thick, but it's not like this tiny knife edge that's going to run away from me. You know what I mean?
What will be the post-op instructions?
For today?
For good, yeah.
Or for good.
Yeah.
Let's go over that in there. But
Okay.
yeah, today it's like, for Kurt, it's don't eat anything that touches 9. And we'll all make sure 9 doesn't touch, when he goes in protrusive, he's going to only be on 8. He won't be on 9 at all. Yep, he won't be able to bite on 9. But typically I just say, hey, take it really easy tonight. Like do soft foods. Try not to eat anything until you're not numb because I don't want you to like bite your cheek, bite your lip, that type of stuff. And then tomorrow, I tell patients to eat whatever they want. I used to say, stay away from apples and jerky. But I mean, most of my patients aren't just biting into an apple. You know what I mean? They're cutting apples and so I pretty much tell them to eat whatever they want. Okay, cool. Let's go debrief in there and let Courtney finish up a little bit. You good, girl?
Yeah. Can I grab you in like 15? Perfect.
Yeah. How you doing, buddy?
You're doing
Dude,
good.
those look so freaking good.
You sensitive or you?
You all right?
You ever go to the bathroom without me?
Dude,
Not yet.
Keep it
But there's plenty.